My name is Kelly Amison, and I am the Rehab Director here at Sebastian River Medical Center. We are pleased that you have chosen the Comprehensive Orthopedic Center at Sebastian River Medical Center to have your joint replacement surgery. Our team is committed to making your surgical experience as positive as possible. This educational class was designed to expand you and your family's knowledge and understanding of all aspects of your joint replacement surgery, including what to expect before, during, and after surgery. As a reminder, this educational class serves as a general guide and should not replace medical advice you have received from your surgeon. Prior to surgery, you may receive a phone call from a member of our nursing staff to review some questions with you regarding your current level of function and your home environment. This helps us successfully plan for your discharge and also allows us to track your progress following surgery. Also, prior to surgery, you should be completing a MRSA screen. This is one way of preventing unnecessary infection following your surgery. If this is not something you have spoken with your physician about yet, please follow up with your surgeon. Also, leading up to your surgery, it's important to drink plenty of fluids. This will ensure that you are well hydrated for surgery. Next, we will talk about how to properly shower prior to your surgery. Everyone should be receiving a special soap from their surgeon. This soap will help decrease the bacterial load on your body to help prevent infection following surgery. You will be showering the night before your surgery and the morning of your surgery. For your shower, you're first going to shower with your regular soap and your regular shampoo. Next, you're going to take a clean washcloth using your special soap, and you're going to wash from the neck down. You've already washed your hair, and I don't want you to pay special attention to your private areas as the soap is very drying. Rinse off and then use a clean towel to dry off with. You're going to repeat the same procedure for both showers. Make sure you use a clean washcloth and a clean towel for both showers. When you're done, no lotions, no sprays, and no deodorants. It's also a good idea to sleep with clean sheets on your bed the night before surgery. On the day of your surgery, we will ask you to arrive about 2 hours ahead of your scheduled surgery time. You will come into the main entrance of the hospital and complete the registration process. You will then be escorted back to the pre-op area. This is where you will be prepped for surgery and meet with your surgical team. We will not be discussing specifics about each surgery during this class, so be sure to discuss specific questions about your individual surgery with your surgeon. Following surgery, you will begin recovery in our recovery area. You will have IV fluids running through your IV. You will also have SCDs attached to the lower part of your legs. That's short for sequential compression devices. Those are sleeves that are wrapped around your calves and inflate one at a time. Those are important because they help prevent blood clots following your surgery. These will only be worn while you're in bed and will be removed once you're up walking. You will be wearing TED hose following your surgery, which are used to help prevent blood clots and swelling in your legs post-operatively. Your TED hose will look like this. After you leave the hospital, you will be wearing your TED hose during the day and then taking them off at night before you go to bed. You will be instructed to wear your TED hose for 2 to 4 weeks following surgery. The TED hose are tight for a reason. They help prevent blood clots. Because they're tight, they are difficult to put on and off. The thing that we found that's most helpful for getting these on is a plastic bag, such as a long umbrella bag. How you use this is you start the umbrella bag over your foot and pull it up your leg. Then you take your TED hose and you pull your TED hose over the plastic bag. Your TED hose will have a hole in the bottom of them where your toes are. You reach in that hole and pull out the plastic bag. That plastic bag will help your socks slide up onto your leg a lot easier. It's also important when removing your TED hose to check your skin. Because your TED hose are tight, you want to make sure that you have no red areas behind your knees, at your heels, or at your toes. Following surgery, you will be receiving an ice machine to take home with you when you're discharged. Ice is the best method to combat pain and swelling following surgery. This is an example of the ice machine you will be receiving after surgery. Prior to surgery, I want you to freeze 8 16 to 20 ounce water bottles. Here in the hospital, we will be filling the ice machine with ice and water. At home, I want you to use the frozen water bottles instead of ice in your ice machine. This will make it much easier for you to refill your ice machine and much safer. There's a pad that's on the end of this tube. This does not get cold enough to freeze your skin. You are able to leave this ice on your sore spot for as long as you'd like. A regular ice pack has to be put on and taken off every 20 minutes. Our patients like to even sleep with this ice machine on all night. Moving on to your discharge home. Some patients may be discharged home the same day as surgery, and some patients may spend the night in the hospital. If you are discharged home the same day as surgery, you will see physical therapy prior to being discharged. The therapist will make sure that you're able to get in and out of bed, transfer, and walk before leaving the hospital. They will also review exercises and review any restrictions you may have. If you are staying overnight in the hospital, you will also see a therapist the evening of your surgery, as well as the next morning. You will have a couple different options for therapy following your discharge home from the hospital. Option number 1 is outpatient therapy. This is our preferred method of therapy following discharge. In this option, your caregiver will drive you to an outpatient therapy facility where you will stay for approximately an hour, and then your caregiver will drive you back home. Option number 2 is home health care. With this option, a therapist will come to your house, work with you at home, and then the therapist will leave. For both options, you will need an order from your physician as well as appropriate insurance coverage. If you choose home health care, you will also require a homebound status, which means that you are unable to leave the house or it is difficult to leave the house for therapy. You will be required to obtain a walker prior to surgery and bring it with you to the hospital. Your walker must have 2 wheels on the front, no wheels on the back, no seat, no brakes. You may obtain your walker from a medical supply company. You may borrow your walker from a family member or a friend, or you may purchase your walker from a secondhand shop. The one thing you want to make sure is that your walker is at the appropriate height. All walkers are adjustable, but you want to make sure the walker can adjust to the height you need it to. How you know that is you step into your walker and you put your arms down at your side. The handles of the walker should hit right at your wrist level. If your walker is too high or too low, they all adjust at the bottom of the walker. One thing to remember is that most insurance companies only cover one walker every 5 years. If you have received a walker in the last 5 years, your insurance company may not purchase another one for you. It's important that you keep your walker for the next 5 years in the event that you would need to have another surgery. Now we're going to talk about different pieces of equipment that might be helpful for you to use following surgery. If you're having your hip replaced, you may have precautions that keep you from bending over to get down to the lower part of your legs or your feet. These pieces of equipment are recommended for you. If you're having your knee replaced and you already know that you have trouble bending over, getting down to your feet, you also may benefit from these pieces of equipment. The pieces of equipment I have out here all come together in a kit called a hip kit, HIP. This kit can be purchased from online distributors, medical supply stores. You can purchase these items individually from Walgreens, CVS, those kinds of places as well. The kit includes a reacher that looks like this. A reacher you can use to help you pick things up off the ground. You can use the reacher to help you get your pants started over your feet. You can use your reacher to help you push your socks off of your foot and those kinds of things. It also comes with a dressing stick. The dressing stick basically acts the same way. You can use it to help you get your pants started, push your sock down, those types of things. It also comes with a long-handled sponge. The sponge would help you in the shower reach down to your feet and the lower part of your legs. It also comes with a long-handled shoehorn. The long-handled shoehorn helps you get your shoes on after surgery, especially if you're having your knee replaced. It keeps you from doing a lot of twisting and pivoting when you go to push your foot into a shoe. The shoehorns you generally get in a hip kit are longer than the ones that you'll find in the store. The last piece of equipment that comes in a hip kit is called a sock aid. A sock aid helps you put your socks on without having to bend over all the way to the ground. What you do is you take your sock and you slide it on the sock aid just like this. This goes onto the ground. You slide your foot in and pull up, and your sock slides right onto your foot without having to bend over. Another piece of equipment that we recommend is a 3-in-1 commode. This is something that's recommended but not required. It is not typically covered by insurance. It is an out-of-pocket expense. It can be purchased from different online distributors, medical supply stores, or you can find one in a secondhand shop. The reason why we recommend a 3-in-1 commode is that it increases the height of your toilet to make it easier and safer for you to transfer on and off of. It has arms on it, so it gives you something to reach back for when you sit down, and it also gives you something to push up from when you go to stand up from your toilet. It can also double as a shower chair by putting it into your shower. That keeps you from having to purchase 2 pieces of equipment. This can double as something to go over your toilet as well as something to go into your shower. We recommend that you shower sitting down following your surgery. You may be taking pain medication that you're not used to taking. You may feel dizzy or lightheaded while you're showering, and it's much safer to shower sitting down. As I mentioned earlier, you will be able to shower after you are discharged from the hospital. Your bandage will be water resistant, but not waterproof. This means that you may let water run over the top of your bandage, but take special care not to saturate your bandage. Your bandage will be a special 7 to 14 day bandage and should not be removed prior to seeing your surgeon in their office for your follow-up appointment. When your bandage is removed, you cannot submerge that area until your incision is completely healed. This means no scabs, no openings, and no drainage. One of the things our patients always ask about is pain control. Our staff will be assessing your pain by asking you to rate your pain on a scale of 1 to 10. Our goal is to keep your pain at a 5 or less. By keeping it at a 5 or less, this will allow you to actively participate in therapy in preparation for your discharge. Everyone's pain is managed individually. If you feel as though your pain is not well managed, please discuss this with your nurse and your surgeon. At discharge, you will receive a prescription for a narcotic as well as an anti-inflammatory medication. I want you to think about how you're going to prep your home prior to surgery. I want you to find a chair that you're going to use after you're discharged from the hospital. You want to make sure the chair that you choose has arms, does not rock or glide, and does not have wheels. You also want to make sure that your hallways and your open spaces are clear of clutter. You want to remove all loose throw rugs and make sure you have no cords in the area. You also want to practice using your walker prior to surgery and make sure it fits through all of your doorways and everywhere in your house that you're going to need to be able to go. You may want to think about also preparing meals ahead of time. You can store your meals in the freezer and they become easily prepared following your surgery. You also want to think of any specific concerns you have about your home, whether your bed is too high or too low, whether your vehicle is really high or really low, whether you have any steps at home, and if you have a good handrail to use. If you have any concerns about your home environment, please write them down and bring them with you when you come for surgery. Our therapists will be working with you individually on addressing any of your concerns. It's also recommended that prior to surgery, you get a new pair of tennis shoes to use following your discharge. In an old pair of tennis shoes, you've developed a wear pattern in them. Because you have a yucky joint, you don't want to put these old shoes on after surgery and go back into that old way of walking. You want to give your new joint a fresh start in a new pair of shoes. One of the last things we're going to talk about is exercise. It's very important to start exercising prior to your surgery. When you exercise prior to your surgery, you develop muscle memory. You have to remember that when you go through your surgery, you're replacing a joint. We're not replacing muscles. So your muscles are still going to be there following your surgery, so it's important to strengthen them as much as you can ahead of time. In the educational book you received from your surgeon, the exercises I want you to start doing now are on page 11. The first one is ankle pumps. This is probably the most important exercise and the one that you can start doing immediately after surgery when your legs start waking up. Ankle pumps are important because they help prevent blood clots following surgery. All you do is pump your ankles up and down. This is something that everyone should be doing in a long car ride, on the plane, those types of things. The next exercise I want you to do are gluteal sets. This can be done sitting, standing, laying down, it doesn't matter. All you're gonna do is squeeze your bottom together, hold it for a few seconds, and then relax. The next exercise is quad sets. You can do this when sitting down or lying in bed. If you're gonna do it sitting down, you're gonna take your leg out in front of you with your heel on the ground, and you're gonna tighten this muscle right here on top of your leg. You're gonna hold it for a few seconds and then relax. You might feel like you're pushing your knee down to the floor. That's what it should feel like. The next exercise is hip abduction and adduction. This exercise you're gonna want to do either sitting up in a recliner or lying in the bed. You're gonna take your leg and you're gonna slide it out to the side and slide it back in, just like this. If you're having trouble sliding your leg, you can use a pillowcase or a plastic bag or something like that under your heel to help your leg slide a little bit easier. The next exercise is a heel slide. All you're gonna do is slide your heel up towards your bottom and then back out. Same thing, if you're having trouble sliding, use a pillowcase or a plastic bag to help you. The next exercise is very important for my knee patients. This exercise is a short arc quad. This is the only time you should ever have anything under your knee. For this exercise, you're going to take a rolled up towel or a pillow, stick it under your knee, and then you're going to kick your foot straight up towards the ceiling. You're only going to move from your knee to your foot. You're not going to move your hip. Like I said, this is the only time that you should ever have anything under that knee. More knees fail because they don't straighten all the way than because they don't bend all the way. When you end up with a knee that doesn't straighten all the way and you go to walk on it, that knee has more of a chance of giving out on you. You want to be able to stand up nice and tall on a knee that straightens out all the way. That's why you never want to sit with that knee in a bent position for a long period of time, and you never want to sit with a towel or a pillow under that knee. So this exercise is the only time that you should have anything under that knee. The next and last exercise is an armchair push-up. This exercise is important because you want to keep your arms as strong as possible prior to surgery. You're going to rely on your arms a lot to get yourself in and out of a chair, in and out of bed, on and off the toilet. So this exercise, what you're going to do is you're going to scoot to the edge of your chair, find a chair that has arms, and you're going to push up through your arms to a half stand and then back down. Most of your body weight should be going through your arms. You should not be pushing through your legs. You're just going to push up and back down. Now, I know that you have a yucky joint, so these exercises you may not be able to do very many of, but I want you to do as many as you can in a pain-free zone. I also want you to space them out during the day. The ones that you can do lying down, do them when you're in bed. The ones that you can do sitting up, do them while you're watching television. The more you space them out during the day, the more likely you're going to get them done. A few additional things to think about prior to your surgery. You want to make sure that you're washing your hands thoroughly with soap and water before handling the area around your incision in order to help prevent infection. You will also want to make sure that you're drinking plenty of water following surgery. This will help prevent constipation, which is the #1 side effect from taking pain medication. You will also continue to take a stool softener following your discharge home. You also want to avoid undercooked or raw fish and/or shellfish for 6 weeks post-surgery to further help prevent infection. We also recommend that you have 24-hour assistance for the first 48 hours following your discharge from the hospital. Thank you for listening today. Our goal is to exceed your expectations. If there is anything we can do to make your stay more pleasant, please let us know. Again, thank you for choosing the Comprehensive Orthopedic Center at Sebastian River Medical Center. We consider it a privilege to serve you.